webinars. Today, we'll be talking to Dr. Terry Smith about his recently published research paper titled, How Patients Experience Thyroid Eye Disease. The paper was very insightful. Thank you, Dr. Smith, for getting this published. The paper was a result of a 62-question survey distributed to TED patients of all ages and all stages of the thyroid eye disease. One of the vital conclusions seems to be a disconnect between the needs of TED patients and the care they receive from their healthcare professionals. Reading from the paper's conclusion, physical manifestations of TED impact quality of life of patients through all phases of the disease. It is essential that physicians and healthcare professionals become more familiar with the patient experiences, such as those described here, to better help patients manage their disease. Here with me today is Dr. Terry J. Smith, the Frederick J. L. Hutwell Professor Emeritus in Ophthalmology and Visual Sciences at the University of Michigan. He is an internationally known endocrinologist who studies Graves' disease, its eye manifestations, and related autoimmune disease for over 20 years. Dr. Smith is the author of 275 articles and book chapters and has been awarded 5 patents for his research discoveries to include the treatment for thyroid eye disease. I want to thank you, Dr. Smith, for being with us today and for your work on behalf of those who have been diagnosed with thyroid eye disease. Thank you for joining.
Well, thank you, Dr. Lohmann, and it's a great pleasure to be with you today and to discuss some of the central findings of the study that you referred to, which really was inspired by my colleagues and I who take care of patients with TED, and those of us who try to translate research from the laboratory bench to the clinic. And, you know, I mean, I've been at this for quite a while. And I must say that the vast majority of the work that we've done in molecular biology and translating that to our patients is inspired by the clinical journey of patients with TED and Graves' disease, which are closely linked in terms of the underpinning mechanisms. But we, I believe, certainly learned a lot from the experience of putting out the survey for consumption by the community and by studying the findings, that is the results of the questions and their answers from about 443 respondents all over the world. And I think that because we cast such a wide net geographically, one of the great challenges was to design questions which were relevant to the vast majority of those individuals, not only in North America.
Yeah, no, I mean, the paper was incredible. I read it, and as someone who suffers with the disease, it was very empowering that you, as a provider, was looking at it from the patient experience. And I think sometimes providers get desensitized by dealing with the medical and the research and the molecular level, that they tend to not view us as people suffering with the condition. And I thought it was very insightful. And, you know, that's one of my first questions is, as a TED patient, This study was appreciated because it speaks to the unmet needs of thyroid eye disease patients. And I would love to know what inspired you. I know you spoke a little bit about it, but what inspired you to take on this project specifically when many people think it's a rare enough disease that wouldn't entail this kind of attention?
Yeah, so really, I had wanted to do this study um, as early as uh, my days in clinical training, when I was struck
Yeah.
by how unfamiliar so many physicians and other healthcare providers were, um, to the nuances and the great need of patients with autoimmune thyroid disease, and certainly Graves' disease and TED. So it had been brewing in my mind for multiple decades, and I thought that now that there has been a sea change over the last 2 to 3 decades in how we attempt to treat patients with the disease, both medically and surgically. It really, the time seemed correct.
Yeah.
And then it was the confluence of opportunity, um, and the emergence of such a well-informed TED community uh, to ask questions of. So, and I was joined by my colleagues, both in Europe, and a former colleague of mine at UCLA, and we decided that this was a extremely worthwhile project, and one in which we might be able to identify those issues proximate to the patient experience and needing greater emphasis.
No, I agree completely. And as somebody who's been living with Graves and thyroid eye disease for 27 years, the new research and the things that you have been doing have changed my life in a way that I never thought possible. So that's one of the reasons why we are enjoying about interviewing you. And what I wanted to know was, did this research confirm what you expected on the quality of life burdens for TED patients, or were there any surprises and things that you learned about TED through this journey of your research paper?
I think in the main, it underpinned and bolstered um, many of our impressions going into the study. Um,
Hmm.
so so there really weren't uh, dramatic revelations, uh, but really, I think, and hopefully will provide the kinds of support for a greater emphasis
Yeah.
on this sort of research. Um,
Yeah.
and and I think that you're absolutely correct in your uh, impression that um, many times providers forget
Yeah.
uh, that we're dealing with uh, human beings who are intelligent and who are striving to improve their lives and to smoothen the ride with various sorts of diseases, and because TED is chronic, that is spans many years, and because we really didn't have particularly good options, either medically or surgically, until relatively recently,
Yeah.
that we as a profession, I think that we, um, because of the relative rarity of the disease, um, probably turned our attentions more to those problems that we saw daily or weekly, and not uh, uh, those that um, might not consume our attention as frequently.
Yeah, I mean, it's a rare enough disease that obviously, your research has taken so much time and, like you said, you started thinking about it when you were, I mean, learning to be a doctor. And now it's 20 years later where this research is now impacting people's lives based on the new medications available. And like you said, the previous treatments before. And I think your paper really hits home because the physicians now can use your research and really understand how quality of life of these patients living with this disease can change how they approach the care they give them. If they don't understand what we're going through because they're not living through it, and they only read the textbook and the research papers on a medical level, the way that you taught or the way that you had this research paper shows it and it humanizes the condition. And I think that's the part that was so important. And I think that, and I would love to know how you think this research paper could help physicians improve their bedside manner to patients living with thyroid eye disease.
Sure. Um, I think that most of our patients really have concerns that that don't get touched
Yeah.
particularly well by those who are managing the problem. And I think that one can look at the unmet need on two levels. Um, Most importantly, um, I hope that patients will feel more comfortable
Yeah.
in asking questions
Yeah.
and really demanding of their doctors and other healthcare providers um, uh, important information uh, and insights into how their journey might be improved. Um, but I think also physicians um, who, because of the demands of their practice and time and uh, perhaps not being as up to date
Yeah.
uh, in especially with regard to relatively rare diseases, um, might not uh, be in a position to render the best advice. Um,
Yeah.
but hopefully the paper will call attention uh, to the disease and the situation of our patients, and motivate um, uh, both patients and physicians um, to learning more about the process.
No. Yeah.
And you know it, we hope that this will inspire further research. After all, this was more or less a learning experience, including that for the four co-authors of the paper and those who participated in uh, analyzing the information and getting it ready for publication. Um, so, but there were four of us who were clinicians, who are clinicians, and I and I've chatted with my three clinical co-authors, and we all feel that we've gained so much in terms of this unmet need being such an important uh, uh, goal. You know, this should really provoke all of us, I think, to be more thoughtful
Yeah.
about about uh, the patient symptoms and other needs, some of them physical, some of them psychosocial.
Yeah.
Um, and I think that as physicians, we probably uh, pay less attention to how our patients are functioning in society,
Yeah.
how how a a process like TED can alter one's confidence
Yeah.
in the business world and socially, with our family, our friends, um, and how severely restricted some of some of the activities of daily life really become more of a burden than they ever have been previously, in one's experience. So that things like driving or reading, using a computer,
Yeah.
um,
Watching
re-
TV.
right, right,
Yeah.
all of those things, because of the visual consequences of the disease, and then I think also, um, how we perceive ourselves as being presented to the world at large.
Yeah.
So all of these things, I think, came out, and um, when we designed the study and crafted the questions and then looked at the answers, um, we, I think, are in a much better position now to think of how we uh, might follow up with
Yeah.
subsequent studies where we more more clearly tailor the
Yeah.
questions. So there are two types of research in my world. There are those that are hypothesis generating, as this study was, and then there are studies which actually test hypotheses. But
Yeah.
one has to have enough information to ask the relevant questions, to construct the best hypothesis to test. And I think now we're in a position to test certain hypotheses,
Yeah.
and we
You've done it
intend to
with your
do so.
research paper. Yeah,
Yeah,
you've created this hypothesis and now you can go on to the next version of the study. And
that's
so
exactly right.
to what you were saying, Maya Angelou says, do what you know until you know better and then do better. And so now your study is out there for physicians to no longer be comfortable with just knowing this is a rare disease. It's, if you don't know how to treat this disease, share with your patients healthcare providers that can. And it really just says is if it's not within your limits, then, don't ignore it. These patients are suffering. And, if you can't understand the knowledge or read it or be up to date with the new and latest and greatest innovative medications to help treat this disease, not just what we know in the past, you're calling to awareness for these healthcare providers to be held accountable to help people like me who was told that I had dry eyes for 20 years and that my exophthalmos with my Graves' disease was just, it's just dry eyes. It's just severe dry eyes. And, for 20 years, people just tell you that. And as somebody who grew up with it, I came up with, my own things of people calling me lazy when I didn't want to go outside. And I'm almost 40 years old. And now I know why I didn't like going outside was because the light sensitivity. So It's brought to light a whole lot of things. And speaking for myself and many people that I've met in the TED community, we often don't reveal to our medical team the difficult emotions and quality of life issues. And specifically, females sometimes are more dismissive because we just need to feel strong in whatever facet of life that we're at. But your study seems to be saying that the dialogue needs to happen and we need to get to the point where we can speak about these things. How can we change this dynamic? Because if the patient's not willing to or unable to ask the right questions, how do the providers also be involved in this?
Well, there's no question that the best patient experience is is had by individuals who are self advocates,
Right.
and um, we know this that that this disease, like so many, um, has um, certain levels of uniqueness, one individual versus another. Um, some patients present with the bulging of the eyes, some uh, with eye dryness, or with double vision, as the particularly troublesome component of the disease. Um, and it takes effort on both the patient's part to fully describe
Yeah.
what the experience is for her or him, and then physicians to um, craft the time and the commitment
Yeah.
to better understand what the individual patient is experiencing.
Yeah. So you're talking about self advocating for yourself. So an educated patient becomes a smart patient. Smart patients then can ask the right questions or be able to express what they're feeling in a way that a doctor may be able to help them and advise them of the next steps. So, I mean, the self care and the well being and advocacy is important on the patient side too. But your research does not include quality of life as related to treatment choices. And I'm wondering if this can be an important factor in one's long term experience with TED.
Well, it certainly is, Dr. Lohmann, and um, uh, we we did include many questions in in our survey, looking for insight into how uh, uh, individual patients uh, responded to the various therapies that that were dealt with in the survey,
Mm-hmm.
both surgical and medical.
Mm-hmm.
And um, uh, the 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 real reason why we were unable to statistically analyze the differences between patients treated with one modality versus another had to do with the complexities
Yeah.
of of patients, and how they're um, uh, being treated. Um, so issues such as uh, where the patient lives,
Yeah.
since this was a worldwide um, accessible survey,
Mhm.
um, the practice habits in Europe and in Asia and in Africa are very different in many ways from those in North America.
Yeah. That makes
The
sense.
Yeah, so surgical availability,
Mhm.
medicine availability can be vastly different.
Yeah.
And um, when we looked at the results of our survey, we we realized that we didn't have enough information about each therapy and how it impacted um, individual patients or as a group of patients.
No, that
And
makes sense.
yeah, so
It's an
what
uncontrolled variable. Like it's not something that you could, you couldn't control what they said, so it didn't make sense on being able to do it in that research aspect. That makes sense.
also, I mean, for instance, the recent introduction of a US FDA therapy for the first time
Mhm.
um, really could be accessed only by patients in the United States.
Oh, okay.
And and when we actually conducted the survey, which was in the early summer of 2022,
Mhm.
remember we were just getting out of COVID,
Yeah.
um, and the relative number of patients who could even potentially access the drug, um, the number of providers who were aware of the drug was limited.
Yeah.
And um, because um, uh, patients outside of the U.S. were not even potentially treated with the drug, um, it led to smaller numbers of patients who could respond
No, that
to
makes sense.
particular questions, the answers of which really are necessary to construct a quality of life sort of a yardstick.
Yeah, that makes sense. We've got about 5 more minutes. I have a couple more questions for you. You noted in your research that there's a great deal of recent interest in treatments for TED from the medical, scientific, and biological communities. How important is each entity to let their decisions be informed by the collective TED patient voice based on your research?
Well, I think that getting a broad perspective from from the community,
Yeah,
whether it's the provider community or the patient community or the family
yeah,
community.
caregivers.
Um, yeah, I I think that that it is the process of trying to draw out consensus
Yeah,
um, among individuals that probably more validly portrays what the typical journey might be. But when one starts talking about typicality, then in many ways it may um, factor out the individuality.
yeah,
So while it's important uh, as a group dynamic to understand those things which are common or uncommon with regard to symptomatology and response to therapy, um, it still necessitates that the doctor, that the healthcare provider um, really focuses in on the individual's needs, because at the end of the day, we're all um, uh, we have unique needs, unique experiences.
yeah. Well, it's interesting because the multidisciplinary approach is obviously the best approach, but the new form of shared decision making includes quality of life, benefits, risks, and everybody needs to be informed on the how and the why. And so, I think to your point, um, and as we're wrapping this up, it's your research paper brings to light a view that most people never saw as healthcare professionals. Like, yes, when someone comes into your office, you're treating them as a person, but if you don't understand and really research how the disease affects the quality of life, sometimes you just go to the most basic treatment, not the best treatment. You just go to the what you already know. And so it's really vital to understand what's out there, the available nature of it, and the TED and the patient perspective. So I would like to ask you one more question. As you consider the results of your research, what is one personal message you would like to extend to the thousands of thyroid eye disease patients that are presently navigating through this frightening, sometimes lonely and confusing journey? And also, I'd like to know what you'd like to talk to your other healthcare professionals about.
Well, yeah, this is particularly critical, um, that that when it comes to taking care of patients with TED, um, if there has ever been a disease process that requires um, multidisciplinary collaboration, um, this is certainly at the top of one's list because it's a systemic disease,
Yeah,
and its causes lie primarily in the immune system, uh, but the manifestations um, are focused on the tissues around the eye.
yeah,
So really, one needs to enlist the help of internists, endocrinologists,
yeah,
um, rheumatologists,
yeah,
and eye care providers, ophthalmologists and optometrists, to optimize the journey. Um, I would say also that, and I'm repeating myself, that it's critical to self-advocate
yeah.
and to speak up to your providers and to uh, uh, give them as unvarnished and detailed uh, a picture of what your life's journey has become in the face of TED. I think
It's
then,
hard to do though, Dr. Smith, because you don't wanna victimize yourself, you don't want to dismiss your disease, but when you come to a doctor and you tell them, "Man, this sucks, I can't watch TV," or "I can't read," or "There feels like there's sand in my eyes," like, sometimes when you talk to your provider, they don't give you the empathy that you need. You just become a number. And so I think your research is important because it actually verbalizes what TED patients go through when a thyroid eye disease patient can't talk for themselves or they don't know the words to do it. And so even if I couldn't communicate you, if you were my ophthalmologist, it could be as simple as like, I feel everything in this paper. This paper says everything that I need to say about how I feel. This is my life.
yeah, certainly sharing language
Yeah.
is fundamental
Yeah.
to optimal communication.
Yeah, so we're all
It,
reading from the same playbook.
it is, and I think that that uh, in particular, it's important for healthcare providers taking care of patients with TED recognize that maybe their lingo is very different from
Yeah,
that of their patient, and to take the time, make the effort to connect in a way which is accessible
I agree
to
with you.
every patient.
Well, I wanna thank you, Dr. Smith, for coming today and joining us for this TED EDU webinar. I wanna thank you for you and your colleagues and everyone else who was involved in bringing the new medications available to treating thyroid eye disease at the source of the condition. Myself has benefited from it, but if you'd like to learn more about thyroid eye disease and TED nonprofit, please join us at tedcommunity.org. From the bottom of my heart, thank you so much for all you do and continue to do for this industry. And I look forward to the next time we talk.
Wonderful. Thank you for having me, Dr. Lohmann.
Bye.